Are you comfortable with just standing up for a little while? Is it going to bother your injury? Are you okay?
Yeah.
All right, just go ahead and stand up for me. I'm going to have you actually slip your shoes off and put the socks on. So let me know if you have any discomfort or you feel like you need to sit down.
Okay.
I'm going to have you stand up nice and straight. Both her patellas are facing forward. She doesn't look like she has any excessive internal, external rotation of the tibia or the femur. Toes look good. Just a slight toe angle out, foot angle out like she should have. Can I have you actually slide your feet together? Heels. She's got about 2 finger lengths in there, so nothing excessive. It's just a little bit of a normal genu valgum. Why don't I have you actually turn and face that wall? Sorry. Can I actually have you take the jacket?
Yeah.
Are you comfortable doing that?
Yeah.
Arches look good on this foot. From this angle, it looks like she's a little rotated. You can see kind of a little bit more of her back left. Looks like she's rotated maybe a little bit this way. Can I have you extend your legs, straighten them as much as you can? So she's not sitting in hyperextension. Go ahead, relax. She's got good knee flexion. Doesn't look like she's overly dorsiflexed or plantar flexed. Go ahead, turn around for me. Just gonna go ahead, check the levels. She looks pretty level. You can kind of tell she has a little bit of rotation here. Check the PSIS. Okay. Knee folds look pretty even. Gluteal folds look pretty even. Go ahead, turn and rotate again.
Sorry. You're fine.
So she does look like she has a little bit of rotation from this side too. You can see a little bit of the right even from straight on.
Where?
Looks like she's a little rotated posteriorly on the left and anterior on the right.
Okay. Is it coming from anything, or is it just in general? I'm not sure what you're saying.
She has like this is rotated back too.
Okay.
Arches look good on this side. Do you mind if I'm gonna just feel for your ASIS and PSIS? Doesn't look like she's abnormally tilted forward or back.
Just for fun, do you know what normal is?
5 to 10. And go ahead, face forward. All right. I think I'm good. Do I just verbalize this one?
Yep. Verbalize what you found and verbalize what you would do.
So, from the looks of it, she is a little more anteriorly rotated on the right. So, I would be curious to test maybe if it's a tightness of her external rotators or weakness of one of her internal rotators that's causing an imbalance. So, probably easier one to test. She's rotated this way. She might have tightness in her external rotators on her left side.
Okay.
So test either probably her glute max for length.
So, would you want to test what's easiest or what's going to give you the most information? And would that test give you the most information compared to what else you would test?
I feel like that would probably give me the best indication.
Okay. That's just a clinical thing. Like, not always the quickest is the best one, right? Mm-hmm. Okay. Okay, so you would test her glute max length? Mm-hmm. Or, okay. And now we'll do functional. What are you going to have her do for your functional exam?
walking, is it gonna be bearable for the pain wise?
Yes.
Okay. So I'm gonna have you walk all the way down the end, slowly turn around, come back. We're just gonna keep going back and forth. I'm just gonna watch you walk to a second.
Okay.
Let me know if you feel unstable, if you need anything, I'll be right here, alright?
Okay.
Go ahead, start walking.
Go ahead and verbalize your findings as you reach them.
How much time do I have?
You're at 17 and a half.
So, I do feel like she has a little bit more than the normal range for hip rocking, even when she's kind of walking.
So she has a hip drop.
Slight, because I think it's a little bit more than the 4 to 7 that you're supposed to normally have.
Right.
So, maybe just slight weakness of the hip abductor muscles.
Okay.
Um,
Anything else notable?
I think her knee motion's pretty good. It's kind of in the normal lateral to medial.
Besides her actual body, what are you looking at when you're doing a gait assessment?
What do you mean?
What other qualities of her motion can you be looking at besides just if her, like what her body's doing? Right. Is she having pain?
Are you having any pain while you're walking?
No.
It's not bothering your back of your thigh?
Not right now.
Anything else?
I don't think she's overly... I think she's getting good supination with her rear foot.
Yeah,
by the
yeah.
looks of it. She doesn't look like she's overly pronating.
So, are you good? What test would you do?
I would test her hip abductors.
Okay.
strength.
How would you do that? What would you do for that?
Manual muscle test.
Of
The glute medius.
Okay, cool. Just so you know, what I was getting at was that she's walking super slow.
Oh.
You know what I mean? Is that her normal gait speed? Your cadence, your step length, those kind of things, those qualities of motion that you're going to look at in gait are really important in your assessment because she could be compensating, and if you have her do normal motion, you might be able to see those.
See those like kind of
Exactly
things a
come
little bit
out.
more.
Yeah. But,
She's not.
Good job.
If she's not normal walking.
right. Okay. So you're at 20 minutes. We're going to do your 3 now. 3 actual documented.
So I would just do
Her
the
screen.
screen.
Okay.
So it's supposed to be like I give it to him and then I ask her way later, but
For sake of not asking way later, let's go ahead and give it to her. And then, you know, in a real exam, how would you do it? Because you do have 10 minutes, and that's pretty realistic to actually how you would be in a clinic. So you do what you do normally.
okay. So you did say you're having a few problems with just a little bit of memory. So I'm gonna give you 3 words, and I want you to remember them. I'm gonna ask you later what those words are. Okay?
Okay.
Just gonna see if we can test your memory a little bit, just to get a little indicator. So I'm gonna give you 3 words. I want you to remember these. Okay?
Okay.
So we're gonna say fat, pill, and allergic.
Fat, pill, and allergic.
Can you repeat that back to me one more time?
Fat, pill, and allergic.
Okay, remember that. I'm gonna ask you later, okay? Then later in the interview, I would ask her again if she could recall what those were.
Okay. We still have 2 screens to do, or 2 tests and measures to do.
Okay. All right, Amy. Are you comfortable right now? I'm gonna get you up on the table. Are you okay being there? Is that gonna bother anything?
That should be fine. I
Let
feel
me bring
okay.
the table down for you. I'm gonna go ahead, hop up on the table.
Okay.
I'm gonna have you lie on your back.
We have 8 minutes left.
Are you comfortable there? they say for sake of having flexible people for the 90-90, she gets to like just straight. Just say 0 from vertical. Straight.
Just take the measurement. Yeah.
It's like we were saying, like if they go past 90, they're like straight at 90 and they do flexion.
Right.
Measure, but
Right. Well, let's see what she is first before we get into that, right?
because I know she's flexible.
I wouldn't.
Are we comfortable here?
Yeah, I feel good.
I'm gonna give you a towel just under your left knee.
Thanks. That would be great. That's even better.
Bad one. Just gonna bring you up a little bit. Let me know if you feel comfortable at all.
Okay.
So what I'm gonna have you do, I'm gonna bring this leg up straight. I'm gonna have it straight up vertical here. I'm gonna have you just extend the leg, so bring your leg up, try to get it to as straight as you can. Alright, go ahead, relax. So keep everything relaxed. I'm gonna move you now, okay? Bring this one straight. Feel tight there?
I
Any
don't
pain?
know.
So it's a smooth motion. Looks like she gets all the way up toward. So my fulcrum goes on her lateral condyle of the femur. My stationary is going to point to her greater trochanter. And my moving arm will go to her lateral epicondyle, or lateral malleolar. Sorry, it's for vertical. Whoops. Stationary arm is vertical. You okay? So she's 0 from vertical. She does all the work.
Okay. Anything else you want to? I guess you can
Yeah,
write
I'm gonna
down your
write it.
findings.
She had no pain reproduction. It was a smooth motion. Kind of more of a ligamentous or capsular.
Okay. Go ahead and write that down. And your last one is hip flexion. We got about 4 minutes, so I'm gonna be able to give you guys some feedback.
Hip flexion?
Yep.
So I'm gonna go ahead. Comfortable there? Any pain?
No.
Smooth motion. So my fulcrum is gonna go on her greater trochanter. My stationary is gonna go halfway between her ASIs and PSIs. And the moving arm will go to the lateral condyle of the femur. And I'm looking for when her hip starts to move, and I'm gonna pull right back. 20.
Okay, document your findings. Is there anything else from your 3 screens that you, or 3 testimeters and screening that you need to do?
Is this good?
What's that? Keep it
Should I?
going.
Okay.
You have 2 minutes left. Is there anything else you want to do with your patient?
Is this a hint?
So you had done the realm. Now would be a good time to test her memory after you've done, right? So you can actually in the clinic simulate. That's how you would do it.
Do you recall the 3 words I told you?
Oh yeah. Fat, pill, allergic. I almost forgot.
Thought you had bad memory.
I do, apparently. Okay, finish your documentation. You have a minute left.